evening, viewers. You are welcome to today's session of Let's Talk About. Let's Talk About is a live show organized by the Trinity United Church, Legon, to delve into the spiritual and social lives of Christians and the Church Universal. Our topic for discussion today is Hepatitis B. According to the World Health Organization, at least 250 million people are diagnosed with hepatitis B worldwide. To help delve into today's discussion, I have with me Mr. Nikote Amon, a physician, and also Dr. Mami Adodankwa, who is a doctor at the UGMC. Okay, so we'll delve right into today's session. You're welcome.
Thank you.
Okay. So when we say hepatitis B, I've heard a lot. I've been hearing it when I go to the hospital, in the society. What exactly is hepatitis B? Mr. Kote.
Okay, so when we say you have hepatitis B, it means you have been infected with the hepatitis B virus. There are 5 hepatitis viruses that we know about. We have A, B, C, D, and E. But usually we pay a lot of attention to the B and the C because they tend to cause chronic diseases. They tend to cause a chronic disease, and they also have serious complications like liver cancer and liver cirrhosis and the liver failure. So that's why we pay attention to the B and the C. So hepatitis B means that you've been infected with the hepatitis B virus. Basically,
okay, so the virus focuses, the main place it affects in the body is the liver.
Yes, the liver. Yeah.
Okay, and Dr. Achua, please, do you have anything to add?
Okay, I'll add that when we say hepatitis or even any condition that has itis at the end of it, it means it's inflammation. And so hepatitis is inflammation of the liver. And then as he said, we have type A, B, C, D, and E. And they all have different transmissions. Most of them are self-limiting. So the A, E, and the D, most of them can go on their own. But then the hepatitis B and C can go on and progress to become something that we do not want it to be. And so that's why we usually pay much attention to hepatitis B and C, as he said.
Okay, thank you very much. So how is the disease transmitted?
Okay, so first of all, let me point out that hepatitis B is very easily transmissible, and it is found in bodily fluids. So the virus can be found in saliva, it can be found in blood, it can be found in menstrual fluid, it can be found in semen, vaginal secretions. All these bodily fluids carry the virus. But the main modes of transmission are number 1, vertical transmission. So that means that a mother with hepatitis B passes the virus on to the baby. But this cannot happen during pregnancy. So that means a baby cannot get hepatitis B whilst in the womb. It happens at birth. You see. And that mode of transmission, which occurs in very young children, less than 5 years, is an infected child will pass it on to another child. Yes. And then another mode, the next mode of transmission by blood is more common in adults. Yes. So it can happen through blood transfusion. It can happen through contact with infected instruments like infected knives, blades, needles. Yes, and the virus too, it's very resilient. Let me compare it to the HIV virus, for instance. HIV virus cannot survive very long on an infected instrument, maybe a few hours, 3 or 4 hours. But the hepatitis B virus can go for about 7 days. So if you have an infected instrument and it's just lying around, you come into contact with it, you're not protected, you can easily get it. Yes. Okay. And then also through unprotected sexual intercourse. Yeah.
Yes. Mm-hmm. Okay, so you mentioned saliva. So if someone is infected with hepatitis B, and maybe you come into contact with the person through a conversation, are you likely to be affected by the virus?
No, it's not very likely. The virus can be found in saliva, but saliva is not one of the main modes of transmission. Simply coming into contact with the virus doesn't necessarily mean you get it. You have to come into contact with sufficient quantities of the virus, you see. So saliva carries the virus, and because it carries the virus, it could cause it. But in an adult like me and you, it is not likely that we'll get it from saliva.
Okay. Yeah. Thanks for your submission. Dr. Adjoa, please, transmission.
No, he said everything about the transmission.
Thank you. So please, what are the symptoms of hepatitis B? Dr. Adjoa, please, I'll start with you. Some symptoms.
Okay, so the symptoms depend on whether it is acute or chronic. So acute is when the person has been infected with the virus recently. The incubation period of the virus is usually between 30 to 180 days. So that's the period within which the virus can be detected. So between the 30 to 180 days, when the virus is detected, some people show symptoms earlier, within 2 weeks. But for most people, they don't show symptoms till about 60 days. That would be like two months before they start showing symptoms. Some of the symptoms include, so there can be jaundice, that's yellowish discoloration of the eyes. Some people experience fever. Some people have diarrhea, vomiting. Those are most of the symptoms for the acute hepatitis. And as I said, hepatitis is inflammation of the liver. So for the chronic hepatitis, some of them may still be experiencing those symptoms, but the most common symptom is the jaundice, where there's yellowish discoloration. Most people do not even experience the vomiting and the diarrhea and all of those things. They only come and say they've realized or they've noticed that their eyes are yellow, or some people are telling them that their eyes look yellow, so they have to come and check. So when they come, we check the liver enzymes to know their ranges. If they're way above normal, you go ahead to do the hepatitis and all of hepatitis B, hepatitis C, among others. Yeah.
Okay, so jaundice is like, when you have jaundice, does it mean you're at a risk of having the disease?
No, so jaundice is a symptom. Jaundice is a symptom not only because of hepatitis or from the liver. Sometimes when you have pancreatitis or problems with the pancreas, you can have jaundice depending on where the problem is, because there's some connection. Sometimes when you have problems with the gallbladder, you can get jaundice. So jaundice is a symptom. But whenever we see jaundice, our first organ that we look at is the liver. Yes.
Thank you very much. Mr. Kote, please. Anything to add?
Yeah, well, she has said everything, but you should also know that sometimes too, you may not get the specific jaundice you are looking for. The important thing is that when you feel unwell, we have people who have been trained to attend to you. The best thing to do is don't turn into your own doctor at home, because what you are dealing with can be very life-threatening. Go to a hospital or to a doctor that you trust and let them attend to you, because you may be waiting for jaundice, but by the time you see the jaundice, you are dealing with something which is very far advanced, which may not even be hepatitis.
Yeah.
So some people say that, like, when you don't know what's wrong with, like, when you get to know maybe you have the sickness, that's where the fear can kill you. So they decide not to go to the hospital to even check or anything. Like, how can one, like, what's the time for someone to go, like the right time? Maybe when you realize you are coughing, or when you realize your eyes turn yellow, the right time to visit the hospital. Mr. Kote.
Well, you know, they say ignorance is bliss. So maybe if you don't know what is happening, you're fine, right? But it's not always the case. When is the right time to go to the hospital? when you feel unwell, you go to the hospital. If you are tempted to go to a pharmacy to buy medications or to do herbal medications, the best thing for you to do is to go to the hospital. Let us check and see whether what you are dealing with is something that needs serious medical attention or it is nothing. Because, for instance, if you are dealing with hepatitis B, maybe at a stage where it is rapidly multiplying and your liver is already overwhelmed, and then you decide that you want to do herbal treatment. You know, the liver is also responsible for dealing with whatever fallout comes from the herbal treatment, right? So that means ultimately you're harming yourself without even realizing it. And by the time you go to the hospital, you've done more harm than what the hepatitis B alone would have even done. Yes, so resist the temptation to self-medicate. Always go to a hospital.
Okay, always go to the hospital. Dr. Aja.
I want to add that, so like I said, the symptoms of vomiting, diarrhea, fever, those are all non-specific symptoms. They are all general. When you have malaria, some people have fever, some people vomit, some people have diarrhea. When you have stomach pain, you have diarrhea, you have vomiting. They are all non-specific. So you may have all of these symptoms and then you have hepatitis B, but you are treating for malaria, you are treating for stomach upset, but then it may be hepatitis B. So as he said, it is always better to go to the hospital instead of just going to the pharmacy.
Okay. So are there vaccines or medications for the treatments?
Okay. So there are vaccines for hepatitis B. Like I mentioned, hepatitis B can be transmitted at birth, and also it is very easily transmissible. So children can also get it under 5 years of age. They are very vulnerable. Adults can get it, but children under 5 years of age are very vulnerable to infection. And so the vaccines target children. So a pregnant woman, you start antenatal care. We test you for hepatitis B. If you have it, immediately your child is born. Within 12 hours, we make sure that your child gets the vaccine. If you don't have it, the child will still get a vaccine. But if you have it, the child gets a specific vaccine, a special vaccine, let me say that way. And for adults who are not protected, you can go to a nearby hospital, get tested. If you find out that from the testing that you don't have it and you're eligible for vaccination, you'll be vaccinated. But then she mentioned the types of hepatitis.
Yes.
She mentioned chronic hepatitis B. Yes. Sometimes, how do you call it? We have acute hepatitis and we have chronic hepatitis B. Sometimes when you get the hepatitis B infection, it doesn't progress to an acute infection. And even if it progresses to a chronic infection, it sleeps. In some individuals, especially adults, you get the infection, your body fights it off on its own. So you develop something we call natural immunity. With natural immunity, you do not need the vaccination. But sometimes after your body has fought it off, you still don't develop that immunity. So you need the vaccine. So you go to a lab in adults who will test you. If you don't have it, and you're also eligible for the vaccination, which the lab will let us know, you get a vaccine. It's usually 3 shots. Yeah.
So the vaccine for the newborn babies, does that mean that like when the mother has it and they give that special vaccine, like the child will be automatically like free from the virus, or it's just to counter-attack the virus?
I won't say it's automatic, but it reduces the risk of the child also getting the infection. So the mother may have it, and the child will get exposed to the mother's fluids, definitely. So the vaccine will start, the vaccine will stimulate the baby's immune system to start producing its defense to the virus before it gets to the stage where we can't do anything about it anymore. Yeah.
Dr. Aja, please.
Okay, I would like to add that before anyone gets vaccinated, first you have to check your hepatitis B status. So you do the hepatitis B surface antigen. Then, if you have ever been vaccinated before, you then do your hepatitis B titer value. On the titer value, you can do hepatitis B profile. So for the hepatitis B profile, there are certain things that we look for. So there's the surface antigen, there is the hepatitis B envelope antigen, there is the hepatitis B envelope antibody, there's a core antibody, there's among others. So when we do the hepatitis B profile, maybe to you have been vaccinated. When you are vaccinated, vaccination gives you immunity. When you have the surface antigen, when you have the surface antigen and then you have the envelope antigen also positive, it means that the hepatitis B virus is rapidly or is still actively replicating or reproducing. So for that one, we will not go ahead to give you the vaccine, because when we give you the vaccine, you may end up getting, or the virus may still be there. So that one will have to treat with medication. Like he said, some people have the virus surface antigen positive, but then the envelope antigen is negative. It means that the virus is not actively replicating. So you have to check all of these before you go for your hepatitis B vaccination. So first you do the test, let them also do the profile, hepatitis B surface antigen, and you do hepatitis B profile. Then if you are cleared, you can go ahead to do the vaccination. Also, when you do the hepatitis B vaccination, at first you should tell us that after every 10 years you should get a booster dose. But now it has been WHO has realized that when you get the hepatitis B vaccination, that's the first 3 shots as you are supposed to. You are protected for about 20 years and sometimes even for life. And so from time to time, you have to go and check the titer value. If it is above 10 international units, it means that you are still immune or you are still protected from the hepatitis B virus. So you don't just go and take the vaccine. You have to check all of these before you take the vaccine.
Okay. Please, you mentioned antigen. Please, can you break it down?
Okay, so we have the antigen, we have antibodies. So antigen is more like the organism or the causative agent of a disease. The antibody is what's the immunity the body builds up to fight the antigen. Yeah, so when the antibodies are present, it means that they are fighting the antigen, or they've seen it before and then they have memory of that particular organism.
Okay, so I'll ask again, how does one combine life with hepatitis B? Maybe if I'm diagnosed with the disease today, do I have to take in some measures? Maybe I have to rest, I have to stay indoors. What are the measures?
Okay, so for hepatitis B, like we said, we have the acute and the chronic. Some people may show the symptoms of the fever, diarrhea, vomiting, jaundice, and all of those. Usually the acute phase is self-limiting, so it go on its own. So you monitor and you see. And then after some time, like the incubation period we mentioned, you can go and check again. You can do the hepatitis B profile to see whether you have immunity, because sometimes it clears, you get the antibody, surface antibody, and then it is protecting you. Okay. But then, for the chronic, no, so you're asking about lifestyle. You go about your normal lifestyle unless you have the symptoms. So you are vomiting, you have diarrhea, you want to rest. But also for the acute phase, apart from your resting, you just have to eat well and eat healthy. Drink a lot of water, eat your vegetables, take your fruits, all of those things. So for acute phase of hepatitis B, there's nothing much you can do. You just have to symptom relief, if you like. Yes, for the acute phase. And you live a normal life. Nobody will know that you have hepatitis B unless you go around telling people that you have hepatitis B. Yes. Yes.
Okay. So you mentioned like the fruits and food. So are you restricted from taking in some food, and which fruits or vegetables are advisable to take
So
be taken in?
you can eat your normal food, just that you have to be careful about certain chemicals or things that you're taking that affect the liver, because the liver is what is infected, and the liver helps to detoxify the body or cleanse the body. So if you are taking alcohol, if you take alcohol regularly, if you take a lot of painkillers like paracetamol a lot, they all go to affect the liver. And so if the liver is currently sick and then you're giving the liver a lot of work to do, you rather make the liver progress to get worse and worse. So as for eating, your normal eating, you can eat. But then herbal medications and all of those things that the liver has to clear or detoxify the body from, you shouldn't take all of those things because you'll make it worse.
Right.
That's what I have to say.
Mr. Kote, please. Life with hepatitis B.
Well, what I would like to hammer on is the alcohol aspect. Some people say that if you are taking a little alcohol, it may be even beneficial. I'll tell you now that it's not true. No alcohol is beneficial for you, so don't take it. If you're a smoker, don't smoke. Herbal medications, very bad. So alcohol, smoking, herbal medications, you should avoid it. And also if you have other conditions which can weaken your immune system, you should pay attention to them so that they're under control. So diabetes weakens your immune system. So if you have diabetes and you're not paying attention to it, and you have hepatitis B2, it's going to make your condition,
Yes, sir.
it's likely going to make it advance quickly. Yeah.
Okay, thanks very much for your submission. So viewers, if you are now joining, we are talking about hepatitis B, how it is transmitted, and preventive measures towards it. Let me remind you that we are streaming live on our YouTube and Facebook platforms, Trinity United Church Legon, and we are also active on our WhatsApp platforms. If you want to send any contributions, you can send your comments in the comment sections or WhatsApp 0501 579 996. We are going for a commercial break. We'll be right back. Stay tuned.
With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians. With the growing challenges of life in light of both global and domestic development, the Christian is faced with the difficult task of balancing survival within a secular system and at the same time living a Christian life that pleases their Maker. It is for this reason that we need to have frank conversations on the many issues of life through the Christian lens. So, we bring to you Let's Talk About. On Let's Talk About, we talk about health, career, dating, marriage, family, divorce, politics, finance, and all the issues of life that the Christian is confronted with on a daily basis. Join us this and every Wednesday on the YouTube and Facebook pages of Trinity United Church Legon, and let's talk about life as Christians.
Yeah, welcome back to our discussion on hepatitis B. If you just joined us, we've been discussing about how the virus is transmitted and how to live with it. I'm reminding you that we are streaming live on YouTube and Facebook at Let's Talk About Trinity United Church Legon. You can send your submissions through the comment sections and they will be addressed. Welcome back. Thank you very much. So before we went on the break, you mentioned the transmission of the virus between children. Can you please throw more light on that?
Well, I mentioned that children under the ages of 5 years often give it to each other. So, children at that age, they are playing with things, they are sharing toys, they put everything in their mouth. You've also mentioned that the hepatitis B virus can be found in saliva. We've also established that the virus is very resilient. Under normal conditions, it can stay on a surface for about 7 days. So you get a child putting anything at all in their mouth. You get a child with sores and those things, and it increases their risk of getting the infection because the child picks this thing up, it has the virus, puts it in his mouth, plays with it, someone else comes for it, and that child comes for it, plays with it, and then they get exposed. Maybe for me and you, that exposure, immune system can deal with it. But for a child, the immune system is very naive, it's young, it cannot deal with it. And even the likely reaction to this is that the child gets the virus, but the immune system doesn't do much to even deal with it. It ignores it. So most children who get infected with hepatitis B virus, that is under 5 years, and even around 10 years or so, they are likely to get a chronic hepatitis B virus. Yes.
So chronic hepatitis B is like, can affect children as well?
In fact, it affects children more than adults. Most adults come into contact with hepatitis B virus. Their bodies their immune systems can deal with it, and they clear the infection. They end up with natural immunity. A few of them will go on to get chronic hepatitis. And young adults, maybe around 25 years and younger, are more likely to get acute hepatitis, which is very difficult to treat and can sometimes lead to liver failure and all that. Yeah.
For the acute?
Yes.
Okay. So I'm still on the children issue. Even according to personal hygiene, we all learned personal hygiene growing up. We were told not to share personal items like spoon, maybe straws, bottles, and things. But in some settings, we tend to find people sharing spoons and other things. And in some schools, I wouldn't say all schools, we realize maybe with the preschool children, so maybe Amma is eating, Amma is being fed, and maybe Kojo comes and wants some. Maybe the teacher would decide to give that same spoon, give the food through that same spoon. What do you think? Do you think it's a risk factor?
Yes, it's a major risk. Because like I mentioned, maybe if it's me and you, probably nothing will happen. And the virus found in that is small, it's not much. By a child, they are less equipped to deal with even those small quantities of those small exposures. And then also the child may also have other injuries. For instance, if you have an injury in your mouth and you come into contact with this thing, it is easier for you to get infected because then it goes through the sore and then goes through the blood. And because of the injury, the introduction into the blood stream is easier. Yes. Yeah, so that's a major risk factor. But that doesn't mean that, because I said that it is found on surfaces for 7 days, it doesn't mean that if you share a spoon. What I'm trying to say is that if you wash the item properly with soap or with a disinfectant or something, the virus should go. If you wash it properly, it should work. But if you don't wash it and then you're using it, then you're exposing each other to the same virus. Yeah.
Okay, thank you very much. Okay, so we would move further and focus on the preventive measures. Dr. Ajwa, please.
So for the prevention, we've talked about the vaccination. So there are other preventive measures for hepatitis B apart from vaccination. So vaccination is one of the primary measures. But then we talked for the transmission, there's mother to child. Then there is the horizontal contact, that's use of sharp objects, like people sharing sharp objects, whether needles or whether a blade cut you, I used it, or those who go around cutting people's nails and all of those things. Yeah. Then unprotected sex, then also having multiple sexual partners. Those are all different modes of transmission. So for the prevention, apart from the vaccination, so from the mother to child, that's where you give the child the vaccination from birth. And the child is supposed to receive about 3 different shots within certain intervals. Then when we come to the horizontal prevention, that's do not share sharp objects with each other, do not share needles, do not share blades. You should not let other people going around cutting people's fingernails. You don't know how they sterilize their items from person to person before they come and cut your nails. So you should avoid that. And then you should not have multiple sexual partners. And then also usually when people are going to get married, some of the labs that we do include hepatitis B and HIV because they are going to be intimate. So you have to more of like check or go for your labs. That's also a mode of prevention of hepatitis B. Yes.
Okay, so for the labs and the checkups, is there a measure put in place? Like, is it free or you would need to pay for that?
It's not free.
Okay.
It's not free.
But
and
for
then
okay.
there's also Hepatitis B Awareness Month, where like we have Breast Cancer Awareness Month, we have Mental Health Awareness Month, and all of those. So we try to educate or make the public aware of themselves that hepatitis B is something that you should also be checking from time to time. So from time to time, like I said, go and check your hepatitis B titer value. From time to time, if you had hepatitis B before, go and check your hepatitis B profile to see where you stand, and then you pick up from there.
Okay. So when you mentioned about those who go around cutting their nails, it just came to mind. Can spirits be used to kill the virus? Like, can it be used as a disinfectant?
Well, I will not say yes and no, because when you are going for surgery, when we sterilize, we put it in an automated machine to sterilize it thoroughly. Otherwise, we would have used just spirit to sterilize it. And yes, so I'm not too sure, but I will not say methylated spirits can just kill or clear the virus. Yes.
Okay. And please, I'm still on the checkup. Can the average individual afford the checkup, like the average Ghanaian at the moment?
I'll say yes, because we try to make it. We want to prevent it as much as possible so that it doesn't progress to liver failure, liver cirrhosis, and cancer. So I would say yes, but I don't know the exact amount that is taking. But then initially or before you could go, the vaccination is actually free. But then when you have to treat it, I know that one you buy the medicine.
Yes.
Yes.
Okay, thank you very much for your submission. So we have a question by Veronica Kwate. She says, you mentioned that the acute phase is self-limiting. I want to know if there are treatments for chronic hepatitis. Yes, thank you. Please, you can keep your comments and your questions coming for them to be addressed. Dr. Ajwa.
Okay. So, yes, there's treatment for the chronic hepatitis. It's an antivirus which you take for some time or you take for life. So you have to see a doctor to prescribe the antivirus for you. And then, like I said, from time to time, you check your hepatitis B titer value, you check your hepatitis B profile. Then you may be asked to stop taking the medication. but then you continue with your routine checks to know whether the immunity is still there, whether there's any reinfection or anything of the sort. But yes, there's treatment for hepatitis B. And when you go and do your profile and then you realize that the virus is actively replicating, you should go for treatment. Some people feel or think that there's no treatment for hepatitis B, it cannot be cured. Not that it cannot be cured totally, but then when you take the medication and the virus is not actively replicating, the damage to the liver too reduces. It doesn't progress as it would have if the virus was still replicating. So yes, there's treatment and you should go for treatment for hepatitis B virus infection.
Mr. Ning, please, do you have any submission?
So I'm also assuming that maybe I'm speaking on the premise that you have gone to the lab yourself, you've done hepatitis B tests, and you found out that you have it. You should go to a doctor, like she said, but I usually prefer that if you have a problem, you go to the doctor and share your concerns with the doctor. The doctor does the necessary tests. I even suggest the test to the doctor so that whatever steps have to be taken, they will be taken. Yes, there are treatments, or we manage it. Yes, we manage the chronic hepatitis. Yes. But like she said, it is likely that if you need medications, you're going to take it for a prolonged period, because hepatitis B, like other viruses like HIV, herpes simplex, they cannot be cured completely. So when we find out that you have the virus and it is actively multiplying, we check your viral load and we realize that we see signs that and this is really bad. We'll give you medications to suppress it, to stop the multiplication. And when you're on the medication, when we do that, your viral load can reduce considerably, so that you may even test and you find out that it may appear negative, but you're not really negative. It is the medications that have worked. You understand? Yes.
Please.
And also, that doesn't mean that every time you go to the hospital because you have hepatitis B, we'll put you on treatments or on those antiviral medications. There are some medications we can give to help support the liver, but it is not everyone who we find has chronic hepatitis that we give the medication. That is why it is important that you go to a hospital, be seen by a trained, a qualified health worker, so that the right thing can be done for you. If you do it yourself at home, you don't even know what medications you need to take, and you may panic and start taking medications, which in the long run are going to hurt you.
Please, I also want to add that, like he said, it's not everybody that gets the treatment for chronic hepatitis, depending on the stage of or the advancement of the disease. So if you advance to cirrhosis, if you advance to liver cancer, the medication is not going to help you. So for that one, we are just going to more like palliative care, because the disease is going to progress and go on, take its course. Yes, so it's better that you are always checking your status, and then if you have to take the medicine early, you take the medicine. But if it progresses, that one, the medicine cannot help.
Okay. So it's better to check your status as time goes on. We have another submission from Honorable Nana Kofi Bang. He says, can you throw more light on how sex can transmit hepatitis B?
Okay, so for the sexual intercourse, he mentioned earlier at the beginning that bodily fluids, so vaginal fluids, semen, saliva, but then saliva is not a main cause. So it's more of the sexual intercourse, because sex, you exchange body fluids. And then sometimes too, there's blood, depending on whatever you do. Yes, that's what I can say about that.
Okay, thank you very much. Please, do you have any submission?
And then also, if you have another genital infection, it also increases your chances of getting it. So let's say you're a female and then you have another genital infection. It doesn't necessarily have to be an STI though, but mainly STIs. So maybe you have chlamydia, you also get exposed to the hepatitis B virus, you are even more likely to get it. Hepatitis B virus on its own is very easily transmissible. On top of it, you have something else which is disturbing your cellular activities there. It's going to make it more likely for you to get it.
Yes,
and not even only hepatitis B. With this genital infection thing, anything at all, any other like HIV, genital infections will make it more likely for you to get. Yeah.
So Nana Kofi, I hope you are following. Yes. So I want to ask, how deadly is like the virus? How deadly is it? Uncle.
How deadly is the virus?
Yeah,
okay.
Compared to other viruses.
The thing about hepatitis B is that it causes a lifelong infection, and it is more likely to cause, even when it is suppressed through its activities, it makes it more likely for you to get liver cancer, especially. Even if you don't get the liver cirrhosis or the liver failure, it makes it likely for you to get liver cancer. So that is why we are very, very concerned about hepatitis B. Based on this, I can say it's deadly because number one, it's not going to go. And number two, true, it may be dormant for a long time, but before you know it, you go to the hospital one day and then we tell you that maybe we do a scan or we examine you, we see some changes, further investigation, and they say you have some liver cancer, hepatocellular carcinoma. Yes. So yeah, it is very dangerous. Yeah.
Dr. Aja.
It is dangerous when you don't know your status and you have not treated or you don't treat yourself. Then the liver progresses to the cirrhosis and then the cancer. So yes, it can be dangerous or it is dangerous.
Okay, thank you very much. So Gojo has a question. He says, what is the incubation period for hepatitis B? What is the viral load and why is it important to monitor?
Okay, so the incubation period is the period, like when you're infected with the virus, the period within which when you go and do a lab test, the virus can be detected. So most diseases or most infections have incubation period. Sometimes if you test when you were just infected, we may not pick it up. But then the virus will be replicating with time. And so there'll be enough or more viruses that when you do the test, now we can pick it up. So even for malaria, sometimes you do malaria RDTs negative. You go and do malaria blood film comment, and then it's also still negative. But you feel that you are still sick. You go in 2 weeks' time or 1 week time, you go and do again, and now they say malaria parasites are 1 million. That doesn't mean at the first time you didn't have malaria. It's only because at that time, our labs could not pick it. So that's the incubation period, the period within which the virus or the infection can be seen or monitored or know that, yes, now you have the infection. Yes. And then the viral load is after the virus has replicated, the amount of the virus that is in the body. That's the viral load.
Okay.
Then, what was the last one? Why is it important to monitor? So it's important because when you know the viral load and you know your hepatitis B status and you know your hepatitis B titer value and you know the profile, then you take action. Whether you are going ahead to take the vaccine or you are going ahead to get treatments like medication for hepatitis B, so that it doesn't progress and doesn't advance to chronic hepatitis B where you have cirrhosis, that's scarring and damage of the liver, and that's not reversible, or hepatocellular carcinoma or liver cancer, which is also not reversible. That's why you need to monitor.
Thank you. And Kelvin Hansen has a question. He says, very interesting, okay. Can hepatitis B be transmitted through handshake or sweat?
No. There are some researches that show that the virus can be found in sweat. But the truth is, like I said, you have to be exposed to sufficient quantities. And secondly, the human skin is a very effective barrier against the hepatitis B virus. So a simple handshake it's not going to transmit it. But if maybe your hand is infected, maybe you put it in your mouth or something, that may end up exposing you to the virus. But even that, it's not likely to actually have sufficient quantities to cause the disease. Yeah.
Okay, so just like Kelvin's question, there are some myths surrounding the disease. So some people say when someone has the disease, it's mostly because of infidelity. Some also say that it has no cure. Please, can you let them know what exactly it is, and then let's share our final words as well.
Okay,
Mr.
so
Kote.
I'll say infidelity is a risk factor because if you have multiple partners, you're increasing your cumulative risk to the virus, and the higher your cumulative risk, the more likely that you're going to get the virus. So whatever the situation, try and avoid infidelity. No, avoid infidelity. But that is not the only route of transmission. Getting exposed to blood products, infected instruments also cause it. And in some people, they get it at birth. So it is not fair to blame it on infidelity for everyone who has it. Sometimes there may even be oversight, and I'm not saying it happens. It's not likely that it happens. But even blood transfusion can cause it. You understand me?
Yes.
Yes. So it is not fair to say that someone who has hepatitis B was not faithful. No, it's not right. Yeah.
Okay, and what are your final words to viewers? Okay, so Doctor, you can throw more light on the infidelity, the myths, and add your final words.
Okay, so for the infidelity, like he said, is more of when you have multiple sexual partners. And then I think we also forgot, like he said, the blood transfusion. So we do, for blood transfusion, before you do the blood transfusion, we check your hepatitis B status, we check your HIV status as well. And then even malaria can be transmitted through blood transfusion. So we check all of those things before we give blood. Yes. And for my final words, I'll say that hepatitis B is kind of curable because now there's medication to stop the progression of the liver damage. And you should check your hepatitis B status from time to time. At first, we were told that every 10 years you go for a booster. But now, before you take your booster, you should check your titer value. If it is above 10, you may not need a booster. But then from time to time, you should check your hepatitis B status. Those will be my final words. Thank you.
Thank you very much. Mr. Kote, your final words.
No, I'll add that hepatitis B is not the end of the world. You may test positive for hepatitis B, but like you said, it can, my colleague here said, it can be very effectively managed nowadays. So it's not the end of the world. The important thing is that you take the correct steps. Don't sit at home and assume you can manage it with herbal treatments. Don't assume that a little alcohol or smoking will make you feel better. And don't sit at home and assume it's typhoid. Go to the hospital and receive the appropriate treatment. Yeah.
Thank you very much. So as Mr. Kote said, hepatitis B is not the end of the world, and you should go and receive the possible treatments as soon as possible. Thank you all for watching today's session of Let's Talk About. I've been joined by two great personalities, Mr. Kote Amon, who is a physician, and also Dr. Mami Adodankwa. It's been great having you on the show. I've been your host. My name is Clara Ningson, and I hope to see you same time next week. Bye.